I'm here for parathyroidectomy. I chose Dr. Zadeh because he made me feel so completely comfortable when I first met him that I just knew I would be in very good hands. He's an amazing doctor. My calcium levels are extremely high. The parathyroid regulates the calcium in your body, and my calcium levels are about 6 times higher than they should be, causing all sorts of nasty symptoms.
She had some localizing studies done that showed that there's most likely an adenoma in the right inferior thyroid bed. So we're going to explore that area, and we're using two technologies here. One is an intact PTH, which is a rapid TTH test, which means that as soon as we remove the abnormal tissue, we're going to send a blood test out, and we know within 15 minutes, 20 minutes whether we got the tissue out and the calcium levels and the PTH levels have normalized, which is great. That way we have an answer so we can finish the surgery knowing that we actually had a successful surgery. Obviously if the levels come back elevated, then we have to re-explore and look elsewhere. The second thing we're doing is laryngeal nerve monitoring, which is a device that actually, when we intubate the patient, we have a special endotracheal tube that has a little sheath over it that is a nerve monitor. And as we are close to a nerve, we can actually stimulate the area of the nerve and identify a nerve. The nerve is extremely important because this nerve that actually rides right deep to the thyroid bed and next to the parathyroid gland, this nerve actually controls your voice and your swallowing. So it's critical that we save it. So we're using this device to help us identify it and save it, which adds extra safety to the procedure. So basically, we're doing a minimum invasive surgery, so we're going to make a small incision about 1.5 centimeters to 2 centimeters in size. You can see here, so basically, if you're measuring it, it's about 2 centimeters. So if you look inside the wound here, this white structure here is the recurrent laryngeal nerve, and it goes from down here all the way to the top. And then this little mass here is the parathyroid adenoma right here. That's deep to a nerve. There was an artery here that we divided using that clevidian ligature. This is the trachea, and then this is the carotid artery. So we're in a very narrow space. But that's our tumor right there. So we've removed the parathyroid adenoma. So right now we're waiting for the blood test to come back, and if the blood test confirms that the intact PTH has dropped to a normal level, then we're done with the surgery. And this blood test returned showing that her hormone levels have returned back to normal, meaning that she was essentially cured. So we got confirmation of her being cured and her hormone levels being normalized prior to her waking up. So she's in the recovery room now, and she'll be going home hopefully in about half an hour or so. And she did very well, very smooth surgery with no difficulties.